Welcome to the supplemental video on paid parent of minor and spouses. When parents are paid to work with children or spouses, there are specific criteria that must be in place that is a little different than with other staff. This training will cover some of those rules and offer some reminders. CDCS is unique in that it is the only waivered service that allows parents of a minor or spouse to be paid as staff. When a parent of a minor or spouse is working with the participant, they can only be paid for specific job duties. It is important to remember that they can only be paid for what is considered over and above what are typical responsibilities for a parent or spouse. Parents of minors and spouses can only be paid for personal cares that are outlined in the personal assistance category. These need to be specifically laid out in the CDCS plan. Any activity outside this scope would need to be done in an unpaid capacity or would be seen as a typical parental or spousal responsibility. For example, a parent could be paid to support their 15-year-old in toileting, but could not be paid to support their 2-year-old in the same area, as a 2-year-old needs typical assistance with toileting. A spouse could be paid for helping with bathing or finances, because normally an adult would be able to do these things independently. However, a spouse could not be paid for making dinner if that is a typical activity for their spouse. Paying a parent of a minor or spouse as a staff person allows flexibility, and there are times when specific assessed needs and/or when an individual's preferences make a participant's parent or spouse a good fit for their support options. Activities that parents of minors or spouses would not be paid for because they are not personal assistance activities would include any paperwork activities, managing party activities, medication management, scheduling appointments, and providing medical care that is nursing level of care. Next, we will look at eligibility. In order to be eligible for this option, there are criteria that must be met. First, parents must meet the definition. That definition for eligibility is any parent that is biological, adoptive, a step parent, legal guardian, and/or legally responsible for the child. When paying a spouse as staff, the participant must be offered other options. It also must be documented in the CDCS CSP that other options were offered, and that having a spouse do those activities is their preference. Finally, for a participant to use parent of a minor or spouse as their staff, there must be at least one area of daily living assessed needs, or ADLs, identified in their Min Choices assessment. If you are not sure if there is one ADL, you can contact your case manager to review the assessment to determine this. It's important to note that ADLs are listed in the PCA part of the assessment. However, they can be in the LTCC portion too. Behaviors do not qualify as ADLs. Next, we will get into some of the rules of paid parent of minor or spouse. Paid parent of minor or spouse cannot be paid for more than 40 hours a week per household. It does not matter how many children there are in the home or how many parents are working. A schedule is always required for a parent of a minor or spouse. The CDCS plan is where this should be provided. You may list exact times or an average of how many hours are provided in the morning, afternoon, or in the evening, as long as it matches the hours that are prior approved. The parent of a minor or spouse should follow their schedule as close as they're able, but they are able to flex the days of the week or time that are worked. However, the number of hours worked a week should be what the number of hours are approved. For example, say a spouse, Mary, typically works 14 hours a week from 7 to 9 a.m. 7 days a week to help her husband, Jim, get ready for the day by showering, toileting, shaving, and dressing. But on Thursday, they have an early appointment, so their morning routine needs to start earlier. Mary assists Jim from 6 to 8 instead of 7 to 9. Mary can shift her hours, which is fine, and she can support Jim in what he needs. She would not, however, work longer one morning, say from 6 to 9 and the rest 7 to 9, because she would then be over 14 hours at the end of the week, which was the approved hours. All hours documented on timesheets should be actual hours worked and should not exceed the hours approved. When planning and creating your schedule, consider the assessed needs and the extra time needed to provide support. The hours requested for paid parent of minor or spouse must make sense for the participant. For example, Taylor is a 15-year-old that is weight-bearing but uses a wheelchair much of her day. She needs assistance with bathing, dressing, getting out of bed, and some supervision outside the typical 15-year-old. However, she has hobbies and interests and can manage her day most independently. There have been home modifications and assistive tech equipment placed in her home to aid in her independence. This technology has made it safe for her to remain home alone for 3 hours. In this situation, it would not make sense for Taylor's parent to be paid 40 hours of support a week, as Taylor has just a few areas of assessed needs that require support that is above and beyond what would be needed at this age. In the next slide, we will look at some staffing examples to help clarify. Wages for paid parent of minor or spouse should be determined as with any other staff. Consider the need, the experience, the training, and lastly, the overall budget for the participant. The paid parent of minor or spouse can be paid up to the maximum PCA rate minus any benefits such as PTO. The only exception would be if the paid parent of minor is doing shared services or the person qualifies for an enhanced rate because of the high level of need. Talk to your case manager to see if you are eligible for an enhanced rate. As with all staff, a job description is required for any paid parent of minor or spouse. As mentioned before, paid parent of minor or spouse can only be paid for personal assistance activities that are needed above and beyond what is typically needed. Personal assistant tasks are ADLs and IADLs, behavioral, support, or supervision. If the number of hours requested and/or the job descriptions for the paid parent of minor or spouse does not make sense for the person's assessed needs, the case manager and managing party will need to work together to determine an appropriate amount or description. A common way of doing this is to start with the number of PCA hours the participant qualifies for. The PCA portion of the assessment does measure for extra time for ADLs, but does not consider additional time that may be needed for behavior intervention or supervision during the day. Sometimes parents are asked to detail this out so it is very clear what the above and beyond tasks are and how long they take. So Taylor qualifies for 2 hours a day of PCA, or 14 hours a week. However, she needs some extra supervision for going out into the community. Taylor's parent would count for 14 hours of personal assistance and 6 hours of supervision for when she's in the community, for a total of 20 hours a week of paid parent of minor support. In reviewing the expenses in the plan, the lead agency must determine that assessed needs are being addressed and that the plan is safe. If the lead agency does not believe all the bases are covered, the case manager may not approve or require other services to be added that could possibly result in lowering the number of hours the paid parent of minor receives. It is the responsibility of the managing party and then the case manager to be sure that the plan covers assessed needs of the participant. This plan should not be seen by the paid parent of minor or spouse as an income program for them. It is a job with a schedule and rules that must be followed. Next, we will look at some of the other scheduling scenarios. As referenced on the earlier slide, paid parent of minor and/or spouse cannot be paid more than 40 hours per week. It does not matter how many people are receiving services in the home or how many parents are providing paid parent of minor. Let's take a look at a few different scenarios. In this first one, there are two minor children and two parents. Both parents can be paid to work on both plans, but they cannot exceed 40 hours total between both parents' hours. The second example is of two adults on CDCS. The paid parent of minor rule does not apply, so each parent can work up to 40 hours. In the third scenario, there is a minor child and an adult on CDCS. Because an individual staff cannot work over 40 hours a week, both parents would still be able to work each 40 hours a week, but have to make sure that child A did not go over 40 hours a week on their plan. Some families may have a minor child on CDCS and a minor child on the Consumer Support Grant, or CSG. The paid parent of minor rule does not cross over to the CSG program. So that means a household with two minor children and two parents could potentially exceed the 40-hour-a-week paid parent of minor between the CDCS and CSG plan. For example, in this fourth scenario, mom will be working with child A on CDCS 40 hours a week. Since she is working 40 hours a week with child A, she would not be able to work with child B, as it would put her into overtime. Overtime is not a cost-effective way to use the budget, so we do not usually approve it. However, since the other parent does not provide hours for child A, they would be able to provide hours to child B, who is on CSG. Here are a few things to know about using the paid parent of minor and spouse option in regards to the benefits and tax implications. As a paid parent of minor or spouse, you have the option to opt out of paying in the benefit of PTO for yourself. This is an option after you've been working for 6 months or have worked 600 hours. This is a benefit through the union. Essentially, it will give you a higher level of pay, but you will not be accumulating the 3.1% of PTO time to be used at a different date for things like the participant has an unexpected hospital stay, or you yourself are ill and need a day off. There is FMS paperwork that needs to be completed even if you are making this change at plan renewal time. This can take up to 4 weeks to complete, so planning ahead is necessary. A few of the FMSs offer parents and spouses the choice to opt out of carrying workers' compensation on themselves. This may be one of the factors when selecting your FMS. Paid parent of minor and spouses do not pay payroll taxes like all the other support staff do. And finally, at income tax time, do not forget to verify if you meet the exclusion rule 2014-7. And remind your tax advisor that the income you make while working with your child or spouse is excluded time for federal and state income tax purposes. You will still need to report this as income and provide proof to your tax advisors that you were paid using Medicaid funds by submitting a letter from your FMS, and proof that you reside at the same house, which may simply be submitting a bill with your child or spouse's name on it that matches your same address. Here are a few things to know about paying a parent or spouse as a staffing service. It may be a good idea to have both parents hired by the FMS, even if one of the parents is primarily doing the work. That way they can be backup if one parent is sick. Remember, time cards need to be completed for when the work was done and who the support was to. Some families have multiple minor children in the home and on CDCS. It may make sense for some of the support to be done at the same time. If this is the case, shared services could be explored. For example, maybe both minor children have an assessed need of eating and hygiene. Parents work with them both during mealtime and brushing their teeth. Maybe one parent takes them to the community together to work on social skills or to an adaptive sport at the same time. In these situations, if they have the same needs, we do allow parents to be paid a shared services rate. A shared services rate could go up to whatever the shared services PCA rate is, minus PTO if they are utilizing that. Your case manager and support planner will tell you what the rate is currently. Utilizing shared services may be beneficial because you can be paid at a higher rate and it also charges less to each individualized budget. Keep in mind, it would be rare that we would approve all of the hours in both of the plans to be shared services only, because there are some things you would not be able to work on with both children at the same time. You will need to follow guidelines on shared services. Here's a few overview of the requirements around shared services. You must carefully document the shared needs that can be done safely and appropriately together and separately. For example, if both have bathing and toileting needs, this is a time they would likely not be able to do shared services due to privacy. In the previous example, you would be able to include eating, hygiene, and community activities as shared services. In your plan and when completing time cards, you will need to document the number of hours at the higher shared rate and the number of hours at the one-to-one rate. These separate rates would also be used to cover situations when they typically do things together, but one child is sick, so the parent only takes one child, maybe into the community. As you can see, this adds another level to the staffing situation. Your case manager and support planner will walk you through this process and complete all the documentation needed if you choose to do shared services. Your SMS will also get a copy of a signed shared services agreement, and we will need to train you on how to complete your time cards within the different scenarios. Another rule of paid parent of minor and spouse is that they are not eligible to receive non-medical mileage reimbursement or bonuses, which can be utilized for other staff. Next, we are going to discuss the importance of the service and the responsibility of it. CDCS and CSG are the only two services in Minnesota that allow for paid parent of minor and spouses to be paid. In addition, Minnesota is one of the few states in the country that allows for this service. Paid parent of minor and spouse can be extremely beneficial to the participant. However, it is something that can be easily misused. Any misuse of this service adds to the reasoning to end it in Minnesota. It cannot be stressed enough that if you decide to use paid parent of minor or spouse, you understand and follow the rules so that you do not jeopardize this option for the thousands of Minnesotans that are benefiting from it. And finally, it is important to remember to take care of yourself. You already have a typical stress of being a parent or spouse and often working a job outside the home. Being a paid parent of minor or spouse on CDCS means you are taking on another job. This adds a new level of responsibility and stress. Being paid as a parent or spouse is a real job with a job description, set hours, set schedule, and there are specific goals you need to be working on with your child or spouse. Build in other services in the support plan to give yourself a break.